Hi, everyone. If I could bring your attention back to the front. Thank you so much for coming to this session. It's my immense pleasure to introduce Fernanda Salvetti and Barbara Bertagni. I'm so sorry if that's not a good pronunciation. Please correct me from Logos.net. Please teach us. We're looking forward to learning from you.
Are you presenting?
Thank you.
Wonderful. Thank you so much for being here and introducing us. We can start directly focusing on a specific experience today, and it's an experience from Maryland, from the Montgomery College.
Can you see my sharing?
Sorry, Barbara?
Can you see my sharing?
You're sharing, not for the moment. Maybe someone may let us know. You can
see your screen.
Like yesterday, we need to do it a couple of times. Maybe it's the same today.
Sure. I try again.
If not working, I can try to share my screen.
I'm trying one last time. Nothing.
Okay.
Let me try to share my screen.
Thank you.
Let's do like that. Share and let's open.
Okay, we see your screen now.
Can you see now my screen? Okay.
Yes. Thank you.
Welcome. And sorry for that. So I was saying that today we are expected to go deeper inside the Montgomery College in order to explore a specific activity, an educational activity, about improving sonographer patient communication in a really diverse and multicultural environment, because we are talking about students from a pretty diverse cultural environment they are from. And so we are expected to talk and to share with you some communication techniques that are mainly aimed at communicating with a multicultural, let's say, mindset and footprint to a specific cohort of learners that are students attending the sonography program. Today, I'm here with Barbara Bertagni. We are also talking on behalf of Professor Linda Zanin, as well as Professor Ianna Contardo. All of them are colleagues of us, and Linda, first of all, is a professor from Montgomery College, as well as from another university, that is the George Washington University, so double casket. And within the Montgomery College, she is the coordinator, the didactic coordinator of the program in sonography or ultrasound. Let's go.
With us today, we have also Anna, that is a digital human, and in a few minutes we will talk with her in order to really practice a little bit and see directly what we are doing at Montgomery College. The starting point of our project was improving clinical empathy and effective sonography patient communication. Research indicates that building a trusting relationship with the patient is a key element not only to make the patient feel comfortable, but also for the purpose of care. Because when as patients we really trust our healthcare providers, we are more likely to openly express our concerns, to share important information about our medical history, and actively participate in the treatment plans. So the idea is involving students in a work on their communication. First of all, to improve their awareness, and second, to memorize a script. The key questions they have to ask to the patient to collect the patient history. And the last, but very important, learning how to deal with emotion with empathy. So we have 3 points. Fer, if you can share the slide with the 3 points memorized.
I'm
We can.
about to do is this one.
Thank you so much. So these 3 points, and I think we can listen directly from the voice of Linda Zanin, what are her goals with students and how we are organizing this activity.
So may I start directly the interview to Linda?
Thank you.
Let's go.
So could you please provide an overview of the benefits and the challenges of using virtual patient avatars to practice effective communication skills in a diverse healthcare environment?
Sure. Well, we are using the patient care avatars, or we're using the avatars to teach our students good communication skills. We use it at various different times in our program, for instance, with our novice students, where they're just learning the actual dialogue, right? What is a normal dialogue to have with different types of patients? So since we are ultrasound, having a dialogue about an abdominal ultrasound versus a cardiac ultrasound versus an obstetrical or vascular, just the very basics of the type of information that we need to extract from patients. But it's not just about the experience of extracting the information, it's about creating an environment for the patient where they feel welcome and at ease in what oftentimes is a very stressful situation, right? Because patients come to us because they're trying to determine if they're sick or if they have a specific condition or pathology. And so there's a lot of anxiety that comes with many patients. Not all. Some patients come for very happy reasons, like they are pregnant and they're taking a look at their baby. But more often, it has to do with patients coming to visit with us to have an exam where they are experiencing some anxiety, even maybe some anger, because, why me? Why am I sick? So that experience there, again, for a novice student in any health profession, if it's nursing, medical students, sonography, physical therapy, whatever it is, there's those initial interactions that are very important about just learning good communication skills. And so that's very important to us. As our students progress through our program, they become much more experienced with their patient interactions because they are at hospitals working with patients. But what they may not have much experience with is the different types of patients that you then get, in addition to, again, the typical protocol and understanding the questions you need to ask, but the very tearful patient, the angry patient, the anxious patient. And so we've built in not just, for instance, an abdominal ultrasound protocol where they're working and understanding the questions they need to ask and the information they're getting, but then we change the patient interaction having to do with, are they angry or happy or sad or tearful? And so we add those additional layers on as we progress through the program. We don't start that way. We start with a very happy patient who is happy to engage and interact and answer the questions. And then as they progress through our program and they become more experienced, we start adding those additional layers of complications. And again, their reactions. And then, for that more mature, experienced student, it then becomes not just the patient's reactions with our students, but the questions that they ask, and they tend to start asking very complicated or involved questions, and knowing how to answer these questions in a professional way, but yet in a way where you're not giving information out that you can't. But students don't want to hear, no, I can't answer, or excuse me, patients don't want to hear, no, I can't answer that. They want to hear some bit of information that will at least calm them down, recognizing that that information will come soon or at another time from another health professional.
So 3 main goals: working on communication, and becoming aware of the importance of emotions. That I have to say that is the more challenging point with students, because usually they are so focused in thinking, what's the right thing to say? What's the right question to ask? That sometimes they forgot they are dealing with a patient that sometimes is in pain, sometimes is afraid of the situation. And so sometimes they forget to deal with emotions, with empathy. And this is very a strong point. Anna, would you like to jump in and we can show what is a digital human and specifically this kind of digital human that was designed with the goal to express emotion and to give students the occasion to practice difficult conversations.
Hello.
Hello,
It's
Anna.
a pleasure to be here with you today. I'm Anna, a virtual human designed to help people improve their competencies through role play. With me, students and professionals can practice their emotional intelligence and conversational skills. I can play different roles in different scenarios. Just a click, and I change my location. I can be in a medical clinic, in the hospital. I can be your colleague or your patient. Anything that can help you in your practice. Here, I'm in the Montgomery College ultrasound room, where the students can practice their emotional intelligence and conversational skill with me as patient. I'm a special virtual human because I can express emotions just like you. I can be happy or very happy as now. I can become angry or very angry. I can also be sad, very sad. I can also change my appearance. Just a click and I change the color of my skin or gender. And I can also change position. I'm standing, but I can also sit down or lying. I usually change position during our simulation here in the Montgomery College ultrasound, as in a real ultrasound exam. It's very engaged for the students.
Thank you, Anna, for this presentation. Your background and the room where you are now is really the room where students at Montgomery College used to practice dialogues. So is their real room that we put as a scenario for this kind of digital human. And what was interesting, Anna, was when you were talking about diversity, because the idea that with a tool we can change the color of the skin, we can change the gender, we can change all what is important to make students in a situation where they can deal with diversity, because diversity is really important and is really challenging. When we think about handling emotions, we think about improving our communications, being able to communicate effectively with diverse people, with people that are different from ourselves, is a key point. So Anna, can you play for us the role of the patient for a minute, so we can really explain better what the students usually face during these simulations. And please be a difficult patient. So I will perform the role of the sonographer. Is this right for you?
Yeah, I will be the patient.
So let's play. Hi, my name is Barbara, and I'm the sonographer who will be performing your ultrasound today.
Hi. Is this going to hurt? I'm really in a lot of pain.
Don't worry, we are going to take good care of you. It shouldn't hurt.
Oh, okay. But I hope this won't hurt. I thought I was seeing my doctor today.
Your doctor will get a report after we are done taking pictures today.
I've been waiting for 45 minutes. What's the holdup, lady?
Oh, I'm so sorry you had to wait so long. We had a patient that had an emergency.
That's not my problem. I had an appointment. If you can get this exam finished in 15 minutes, I'm leaving.
Well, I'm going to be as quick as I can, but it will take about 30 minutes to complete the exam. Or if you prefer, we can reschedule your appointment for another day.
Fine. Just hurry up.
Okay, thank you, Anna. You were very tough on me today.
A very,
Thank you
very
for
tough
your help.
patient.
Thanks to you.
Thank you for your help. Bye, Hannah.
Thank you. Bye.
So what learners are learning is also the name and the shade of the main emotions that they are expected to display and to manage and to deal with during these dialogues. So there are measurement ongoings, because there are applied research ongoing around this project. And what we are figuring out, working with Linda and with other colleagues from Linda's team, is that students are learning a lot around emotions, are learning the names, the shades of the emotions, and are learning how to handle challenging patients. Let's skip to say difficult patients, but at least challenging patients, in a way that a traditional ultrasound module based purely on simulation of the technical performance is not able to guarantee. So they are really learning a lot more compared with the previous teaching experience based on a similar curriculum delivered in a more traditional way.
Fer, you can share I think it's the last slide, the one with the circle that present the organization of the activities with the briefing, the simulation, and the debriefing. We can't see. Okay. Thank you. So usually students arrive in the classroom and the instructor introduces the scenario and the goal of the simulation. So each simulation a different goal, but always practicing the conversation with the patient. Then there is the role play. At the very beginning, students were performing, playing with the teacher, and then they practiced in pairs. Practicing in pairs is really important because when you have to practice as an avatar, performing as the patient, you are in need to really think about the emotion you would like to express. And you have really to make the effort to put yourself in the patient's shoes. And this is really important. At the same time, it's important practicing in performing the role of the sonographer. After the role play, that usually lasts around 10 minutes, there is the debriefing, where the students discuss what happened and the observer described without judgment what they noticed. And then the students are writing down all the best practice, all the phrases that they think are very good to use or sorry for this, all the good behavior that they have spot in the situation. And we have grids that we are following. Fer, if you would like to share one of the communication grid. Thank you.
This one?
So
Okay.
the first grid is about the information that is important to share during the interview. And the key moments thinking about communication. The greetings, introducing to the patient ourselves, confirm the patient identity. Confirm that patient identity is something very difficult because sometimes patients can't understand why they have to say again their name, but is a part of the procedure. So finding a good way to make this part of the conversation understandable is very good. Confirm the reason why the patient is taking the ultrasound and so on. These are all the key points that students have to memorize. But then there is the second slide that highlights the way students have to learn how to communicate. So at a non-verbal, at a verbal level, they have to ensure that they are at the same level of the patient. If the patient is lying, better talking while we are sit down, maintain eye contact, remember to smile, and so on. And the last checklist is about emotions. So when they debrief the conversations, they really focus in understanding if there is an active listening to the patient, if the sonographer was able to show support. And showing support means avoiding judgment. If the sonographer was able to make patient comfortable in the situation, being respectful, and so on. All key points that students learn practicing and observing other students practicing. Fer, would you like to add something?
Yes, about the empathy. What we are understanding is that teaching and learning empathy is not easy at all, mainly if you are, as usually teachers in this field and the students in this field are, people very aligned with the technological side of the performance. so performing the ultrasound, as well as with the technical side of the field, means knowing the human body, the different regions, the different organs that are building, let's say, the human body. Having students and the faculty shifting toward empathy, learning how to handle sometimes very challenging human relationships mediated by the ultrasound equipment, in my opinion, is not easy. So how you can really guarantee that both the internal faculty and the students will learn how to empathize, will learn how to handle challenging emotions in this setting, and with their mindset. This is quite a long question, sorry.
Learning to deal with empathy is also strategic for students to, in the future, work with the guarantee of well-being. Otherwise, working with patients make a physician, make sonographer feel a lot of different emotions, and grasping with emotion is not easy at all. So what are our findings till now is that students are gaining awareness about the emotion of the patient, but most of all about their feelings. And this is really a good point, because when you become aware of your feeling, you have a key to handle them and to deal with other people effectively. Till now, we are collecting the feedback from students and from teachers, and I think they are enjoying the experience. Students are enjoying also the technological side, because they are working with the digital human, and they are working in this environment. At Montgomery College, they have this wall called the Real, where they can interact with the digital human, touchless, by vocal command. And they really like the experience of learning using technology. And then I think the big second point is that they have the feeling that they are growing in competencies, but also in awareness. And they are discovering, let's say, the other side of the physician-patient, of the sonographer-patient relationship.
We are left with 30 seconds. Let me say that diversity and inclusion are really taken seriously inside this program, and the learners community is benefiting a lot about that. If you should have questions about this project, please feel free to write us. We can also ask Linda Zanin to directly answer your questions. Thank you so much.
Thank you so much.
Thank you so much.
Thank you, guys.
Very well.